The World Health Organization was founded on 7th of April 1948. The principle that all people should be able to realize their right to the highest possible level of health. Every year, a different theme is selected, keeping in mind the global public health concern. World Health Day is a day to reaffirm our gratitude and appreciation to all those who work day and night to keep us healthy. It's also a day to reiterate our commitment to supporting research and innovation in healthcare. Dr. Arora, to begin the discussion, I would like to know from you, what is this year's theme of World Health Day and how significant it is?
So, as you, in your opening remarks, you mentioned, the health is this year's theme is to reach everybody, health for all, and taking the health to everybody. And the whole issue is about access of health facilities, about the feasibility and affordability of health facilities. And that is the paradigm this year's World Health Day tells us.
So to add in this, Dr. Arora, we recently came out of the pandemic, if we can say, and we know how COVID-19 pandemic affected the global health. In a glimpse, if we can talk about India's performance in order to deal with the COVID, how the world widely appreciated it, be it how we put lockdown on time, the fast-paced manufacturing of vaccination, and then how the biggest vaccine drive was implemented and executed. Can you please share a detailed overview on that as well?
So, in fact, it is so relevant and timely that this year's World Health Day we are celebrating, and the theme is very apt, which applies to India. India reached 97% of the adult population, and the primary vaccination with COVID was done. Now that itself indicates that our access is almost universal, because if I am able to reach adults whom I have tried for the first time, and I am able to give COVID vaccine to 97% of my adults 18 years and above, I think this is a great feat, and it indicates that we are now in that stage to take off, that we are able to reach everybody. Take the most essential intervention, which was immunization for COVID, to every part of the country, every region, and howsoever remote it was. I am sure all of us are aware that in Arunachal Pradesh, the vaccine was delivered through drones, and even for less than 10 people, the vaccination centers were set up. Now, having said that, it has also told us where are the gaps. It has told us that during 2021, when Delta wave was there were issues about beds, there were issues about ICUs, there were issues about ventilators, about the oxygen issues. And so I think India has taken whole issue of COVID not as a tragedy, but as an opportunity to identify, and then also an opportunity to strengthen ourselves. And therefore you find now we have just looked at the national COVID program, and we find that, for example, oxygen is now available all the health facilities wherever inpatient admission is to be done. And for next several decades, we should not have any oxygen deficiency. Similarly, ICU beds and ventilators. I'm sure many of us do not know, when we started with the COVID pandemic, we had just about 12 or 13,000 ventilators. Today, functional ventilators are 76,000 across the country, and now we are manufacturing. So COVID has helped us to, on one side, the resilience and the capacity to reach everybody in this country. On the other hand, it has also told us that where to strengthen, where to focus, and how we should see that it is not only next preparedness for the next pandemic, it is also telling us that for our routine health care, what are the additionalities we need to do, and to see that all of us seek health with a matter of right, and also as a matter of pride that the quality of health services are one of the best.
Since we are discussing about India's effort in the health sector, here I want to understand from you, Dr. Arora, that if we talk about Mission Indradhanush that was launched in December 2014, last year the Ministry of Health virtually launched Intensified Mission Indradhanush 4.0. So can you please describe and explain about Mission Indradhanush and Mission Indradhanush 4.0 and how significantly has it helped us?
So this whole strategy of Mission Indradhanush has been praised and appreciated all over the world by WHO. And the whole philosophy is you reach up to every child who has been left out from immunization or those who have incomplete immunization. And this has led to over 90% of our children being fully immunized. Unfortunately, during COVID, there was a slight back, and we have to accept that. And that was the reason that there were outbreaks of measles recently. But now 4.4 is again the same issue, that almost the whole country is covered under that. And this another philosophy of zero-dose children. So those children who have not received the first DPT-containing vaccine or pentavalent, although they might have received BCG or birth dose of oral polio and hepatitis B, they are being identified. This is part of the international approach. And the whole issue is that before the end of this decade, we should have half the current zero dosers. Current zero dosers are around 6% at the moment. And I think we should be able to achieve this much earlier, because I think it's a highest political will and desire that our prevention is better than cure. In fact, this Mission Indradhanush's whole approach is to see that nobody is left. And this whole philosophy which Honorable Prime Minister said, that every public sector program, it has to have 100% coverage, and it is fulfilling that. The other issue of great pride again is that all these years our daughters and granddaughters were left out with a very important vaccine which is called HPV vaccine, and which prevents cervical cancer in women. And that vaccine is also going to be introduced in the third quarter of this year, and this is going to be manufactured within India. So in the immunization sector, I think a transformation has occurred. I would give you a figure. In 2014, the vaccine coverage, fully immunized children were just around 59-60%. And today, again, we are reaching beyond 90%. This is a major gain, and Mission Indradhanush has played an important role. Another positive thing about Mission Indradhanush is that system strengthening has happened. Now, what does system? Rajendra Dhameja ji knows it better, that he manages a system. The system strengthening means now we have a head count of every child. We know how to reach every household and every child. And what are the supply systems? How do we manage that there is no stock out when vaccination sessions are organized? And we are aware that what we have learned from COVID, that very soon the same COVID will be used for immunization also. So all in all, what we are witnessing that immunization is a flagship program for the whole sector. It is probably the best performing. But the important point is that this is also influencing and helping and teaching us how to reach every individual. And during COVID, that's how we were able to reach 97% of adults for giving the primary vaccination.
And Dr. Arora, on the same line, India is aiming to make our country TB Mukt by 2025, that is 5 years ahead of the global deadline.
Now the system has the confidence that if I want to reach anybody, I can reach the program, because that is access issue is very important, and the system has the resilience. And another important component which has occurred during last 6-7 years, 8 years is that we have started using very intelligently, strategically IT for our health programs. This makes the program more efficient. This helps us to keep an account of whom we have reached and who are left out. And a very important component of any public sector program or otherwise also is accountability. So when I start using IT for my health delivery systems, distribution of services, identifying the beneficiaries and IT issues, accountability is built in. And if there is a crack anywhere, if we are not able to fulfill the requirement anywhere, we can catch hold of the system or we can catch hold of the individuals, and appropriate actions can be taken.
And with these tips from your side, thank you so much, Dr. Arora, for joining us today on All India Radio.
Thank you very much.